So after that, I think I'll call Dr. Vineet. Dr. Vineet is a very, very social media savvy. I'm sure a lot of you would be knowing him. He's all over the social media, conducting teaching programs. He was with Unacademy, Byju's. He's a master of social media. So here's Dr. Vineet to us.
Can I have my slides, please? So first of all, I thank Kamal sir and AIOC for giving me this opportunity. And we have this special instruction course where we talk about the things which are not taught in our medical colleges. So Anjani ma'am told us about the patient referrals and how to basically deal when the patient, how the patient comes and how the patient goes, why it is important to you. And I would be talking about how to talk with the patient. बात कैसे करनी है? तो जैसे मैम ने बताया था कि lot of things go in a straight way if we talk good to the patient. Can I have my slides, please? So that we would be talking about. So sir, my topic is master the art and science of patient conversation and conversion. So कैसे आप बात करेंगे and after उससे बात करने के बाद वो patient आपसे treatment लेगा, surgeries कराएगा, ये हम आज बात करेंगे. So first of all, what is the meaning of patient conversation? It is exchange of information between a patient and a doctor. So patient comes to my OPD and he tells us about his disease, and the doctor first listens it and then the doctor provides the information how to basically go forward in this disease. So what is the importance? We have all the reports. So sometimes patient comes and shows me, sir ये सारी reports हैं, ये देख लीजिए. मैंने कहा कोई बात नहीं, आप बैठिए, चलिए बात करते हैं. So it's not only just the reports that we see, it is how we talk to the patient that is important. Why? First of all, it helps in the treatment compliance. I am not an AI that you just put your reports in Chat GPT and Chat GPT tells you about the diagnosis and the treatment. We are more than that. Patient feels supported and connects to the healthcare provider. Now he knows that this is the person which I should contact and he would basically make me disease free. Third, it helps in better understanding and subtle clues which can go a long way in the diagnosis and treatment. So sometimes a very small thing which the patient tells you would tell how to manage this patient and what is the diagnosis. It helps in understanding the special needs of the patient which can be taken care of. That I would show in 2 examples. So my first case, one is sir, a 65-year-old male patient presents to the OPD and he was very aggressive with the staff. On entering the OPD, he argued with the doctor also, and he says that, sir, I am very uncomfortable in every hospital that I come, so I am not taking the medication. He is a glaucoma patient. So there are 2 scenarios. So the first scenario is, the doctor greets him well. He tells his PCT to get a tea for the patient. He apologizes for the inconvenience caused unintentionally, but he is firm that in a hospital setup, sometimes there can be a waiting. So you have to be firm also. You are not doing this deliberately. The patient listens and tells that his specific problem is going to a toilet on wheelchair. So actually that was his problem. The doctor asks the center manager to help the patient and guide him for the disabled friendly washroom. So we have everything in our hospital, but still the patient is unhappy. Just listening to him, now he is happy. The scenario 2 is doctor also got agitated. He told the patient to never visit his hospital and go to a place of her own liking. And when the patient is leaving, he tells the patient that your miserable condition is just because of your rude behavior. So which would you prefer? The same patient, the same, everything is same, but through one, the patient now gets a solution to his problem. He sticks to the treatment as his vision is saved. Now this is the case 2, sir. A 45-year-old male who is a yoga teacher was diagnosed elsewhere as a patient of disc suspect. So many patients we are seeing which are glaucoma suspect. And he is referred by a general ophthalmologist to me for the consultation. He was really tensed and he read Google Baba, and now he thinks that everything is gone, my life is root. So the scenario 1 is he came to a hospital and the doctor also, he told him that this is a blinding condition and if not treated in time, you can go blind, you need a thorough checkup and writes 7 tests: gonioscopy, fundus photo, OCT, pachymetry, visual field applanation, tonometry, a 7,000, 8,000 rupees bill. He's a yoga teacher. He might not be having that affordable. And the patient is already gone. And patient leaves without getting any of the tests done. Now he's in depression. Now the same thing, scenario 2. The doctor greets the patient and tells, though the optic nerve is a little suspicious, still he has come at an appropriate time. He is a patient of just dissuspect. I say to him that your pressures are okay, you do not need to worry, and with the help of modern diagnostic and treatment, you can live throughout your life comfortably. Like a lot of patients who are on anti-diabetic medications, anti-hypertensive medication, they are living comfortably. Similarly, you would be also living comfortably. You might need a medication. Talks about him, about his apprehensions. I told him he's a yoga teacher, so he was doing Shirshasana and all that stuff, which might increase the intraocular pressure. I tell him to just avoid that. Lifestyle modifications need to be done, and then tell that, okay, these are few tests that need to be done once in a year as per your comfortability. If you need any discounts, you can come to us, but make sure that he basically is contented and he basically sticks to the treatment. So the same thing, everything is same, but the results are different. So I'm just showing you a video. After that, I would be talking about the rest of. Can I have the voice, please?
Voice.
Volume. नहीं कैसे हैं आप?
ठीक है
सब ठीक है
जी।
तो आप काला मोतिया के लिए आज दिखाने आए थे?
काला मोतिया के लिए आए थे।
चलिए, तो आज हम थोड़ा सा एक बार आपको देख लेते हैं। और आपके साथ भी कोई है?
नहीं, मैं
आप अकेले आए हैं? ठीक है, कोई दिक्कत तो नहीं हुई आपको यहाँ पर? ठीक है, एक बार आप चश्मा उतार लेंगे, मैं आपको देख लेता हूँ। ग्रीट द पेशेंट। आफ्टर ग्रीटिंग द पेशेंट, वी एग्जामिन द पेशेंट। क्या आप थोड़ा सीधा देख सकते हैं? वेरी गुड। So we examine him briefly. ठीक है, तो बेसिकली जैसे कि हम काला मोतिया के बारे में बात कर रहे थे, तो जैसे सफेद मोतिया और होता है, काला मोतिया होता है। We talk about the patient, about the disease. कमजोर होने को कहते हैं, तो कोई परेशान होने की जरूरत नहीं है। Tell the, reassure the patient. टेस्ट के द्वारा you are a healer, not only just a treatment provider. आप सब इलाज करते हैं। जैसे आप ये देख सकते हैं यहाँ पर वीडियोस में कि काला मोतिया कैसे होता है, या आप कुछ whatever you tell to the patient, show the scientific evidence. तो दिखाऊंगा तो आपको दिखेगा कि आपकी भी कुछ ऐसी है, तो ये अर्ली स्टेज ग्लोकोमा है जो कि किसी भी। So basically why I showed you the video. So whenever the patient comes, always respect. What is the meaning of respect? R means repet. Make an eye contact when he is talking to you. Don't be on your mobile. Okay? Explain the disease. Explain why you are getting the treatment done. What are the tests that you want? Show his fundus photograph. Show his clinical photograph to him. Practice. Ask about the feedback, and as Dr. Anjani told us, that ask if there is any query that the patient can have. Empathize. Very important is doctor empathy. You always tell the patient that I am with you. Whatever the bad thing happens to you, I would always stand with you. Collaborate. Ask the attendant. Let's say the patient is having some cardiological problem. You ask your cardiologist, or you tell the patient that I can basically consult to your cardiologist and basically do your treatment accordingly. And use technology, use AI tools, show the research. If you are doing it MIGS, microinvasive glaucoma surgeries, tell what is the latest things that going on. So always respect. Now I come to the second part of my topic, that is economics of patient conversion, from advisors to doers. So everyone has a lot of setup, have put capital there. Now you want that whenever the patient comes, he should at least take your treatment. So as an ophthalmologist, what we do, sir, we basically prescribe medicines, we do some diagnostic tests, and we do the surgeries. So from advice, now it should be done. If you just advise and the patient is not basically complying to the treatment, it is not basically adding value to your organization. So what is the things which I want to basically tell you in briefly? So whenever you tell about the diagnostic test, please explain why you are getting that done. If you are talking about perimetry, tell the patient that sometimes what happens is there is a field of constriction. It would basically be better if you do a perimetry, because even subtle changes can be picked up. If you are doing an OCT, you tell why you are doing an OCT, what is the basic aim of doing OCT, and how would you proceed if there is any problem in the OCT. And the rest of the things, whenever you get it done, please tell the patient why they are important. Similarly, medicines. Lot of patients are basically being provided medicines, at least in chronic scenarios like retina or glaucoma. You tell the patient that, okay, you have to take the medicines, and what the patient would do is go outside your hospital and purchase the medicine. Most of the hospitals now have in-house pharmacy. So you tell the patient that please take the medicine from my pharmacy, and I would tell you how to put a medicine. So when the patient gets the medicine, you yourself tell the patient that, okay sir, this is how you have to put the medicine. That would be the confidence giving to the patient, and he would put the medications in a proper way. Also, just 2 minutes, sir. Also tell the patient that it is very important that you take genuine medicines, it should not be spurious. Similarly, surgeries. You tell the patient why there is a need for surgery, and just tell the patient that even after surgery, you don't have to basically have 1 month before you go to your daily routine. You can be back within 2 to 3 days to your normal practice. Tell the patient that it is the only one-time surgery if you are doing a cataract surgery, and get the best thing that is possible for you under your budget. Always keep the things open. If the patient does not get the investigations done from you or surgeries get done from you, still contact the patient. Ask him why you have not done this. Are you not going for the surgery, or there is some financial issues, if I can provide any discounts if possible. And do not over aggressively push the patient. If you are doing it over aggressively, what he would do, what we would do in our mobile, we block the number. Similar thing the patient would do with you. So thank you very much, sir.